Welcome to this short demonstration on trigger points. So really important with trigger points that we warm up the tissue first. Yep, you can absolutely go straight into trigger points. I'm pretty sure if we work through most muscles in the body cold, we would find trigger points. But really, we want to get to the deep-rooted, stubborn trigger points. Most of those superficial ones will fade away through general massage, effleurage, petrissage. And then we get to those deeper, maybe longer holding trigger points within the tissue. So what we really want to do is warm up the tissue. And this is going to help us find the parts of the body that need trigger pointing. How you might palpate that is that, for example, here we're working through the upper traps. We get really good results, we've done some STR, but you find that there's some bands within the muscle that still feel tight. So we're looking for those palpable bands of tension within the muscle. So the whole muscle might not be tight anymore, but you feel those bands. And they're really a good indicator that there's likely to be trigger points in that area or in those bands of tightness within the tissue. So we want to be able to palpate that and you feel, yeah, I've done a lot of good work, but it feels like there's still some tension. That's where we're going to start looking for trigger points. Okay, so it's only useful, or you're only able to find those if you've really warmed up the tissue first. Next step in terms of the client is we can have a good idea that, right, we suspect there's trigger points in a small area of the tissue. But actually, where the trigger point is, the only person who can really tell us is the client. And as you practice, you will get much better at being pretty sure as to whereabouts the trigger points are, but you'll never know that you're really on it until you get that confirmation from the client. So this is very much so an active technique where we need the client's feedback and we need the client involved. And it literally involves millimetre by millimetre movements, because if you move too quickly, the client might say, actually that all feels fine, there's no trigger point. But as soon as you slow it down and you're a little more subtle, you might realise that there's 6, 7, 8, lots of trigger points, but they're very, very small, discrete, specific points within the tissue itself. So we're going to warm up the tissue, and I'm going to work through the trapezius first. So that's an area where a lot of people hold tension around the neck and shoulders, and also if it's chronic tension and somewhere where they're tight all the time, that's the kind of area where you're likely to find trigger points as well, in those overused, over-contracted muscle groups. In terms of applicators and posture, probably more so than any technique we've done so far, issues or inadequacies perhaps in your posture or in your applicator will show on a trigger point, as you need to hold that pressure and that position for anywhere up to a minute, but certainly for a minimum of 20 or 30 seconds. Suddenly a position that feels quite nice, by the 30th, 40th, 50th second, your body's going to let you know that that posture is not helping you. So we really want to make sure that we're in a good position, and don't be afraid as you work through trigger points in an area to move, because various angles, you might need to change your posture as well. As always, if you're not comfortable, guaranteed your client's probably not comfortable either. So in terms of applicators, I've worked through this client's upper traps, and he seems to have a lot of tension in two places. One along the insertion points at the spine, or the origins, and again at the insertion point towards the shoulder and coming down to the acromion process. So firstly, working towards the spine. I'm going to use an assisted thumb here first, as they're quite close to the neck. If we were working more in the thoracic area, I might use an elbow. That's a really nice applicator for trigger pointing, but I don't really want to come down on an elbow into the neck. The shape of the neck, the size of the neck, I don't want to be able to do that. I need a finer applicator. So I'm going to use a thumb, but what I don't want to see is any tension through the applying applicator, the thumb. We want to keep it passive and the pressure to come from the top hand. So we're going to move through the tissue, find those bands of tension. Next, What I don't want to do is apply that pressure in towards the bone. So as with STR and our other techniques, we don't want to be crushing tissue into bone. So I still want to hold that, that theory or that logic of coming in at a 45-degree angle. I always think about teasing tissue away from the bones. One, it helps take up the slack, so allows me to move in smaller increments. And two, it makes sure that I'm not crushing tissue into bone. Another consideration is if you've used a wax like I have today, then it's nice to work through the towel, so trigger pointing is lovely through the towel, or through a small towel, a microfiber towel, if that's what you find useful. So this client's quite slippy, so I'm going to work through the microfiber towel. This will allow me to move in much smaller increments and make sure that I find those trigger points. So I'm going to find the bands of tension. And what I'm going to do is add some pressure, still coming from my back leg, and then I'm going to ask my client. So let me know if I find any very sensitive or tender spots. And what we're going to do when we find those tender spots is I'm going to hold them. And what we're hoping we'll find is that the pain doesn't get any worse. It might stay the same, but then ultimately the pain will start to fade until it's gone. If we hold that point and the pain gets worse, that's indicative of damaged tissue, so we want to come off. So it's important that we explain that to our client before we start. So just let me know if I hit a tender spot.
Yeah.
Okay, so we found one here. So I'm just going to keep that pressure consistent until it starts to fade. Usually wait about 10 seconds, and then I'll ask, is the pain getting worse, staying the same, or starting to fade?
Starting to fade.
Okay, good. So we're just going to hold it. Let me know when it's gone or it's just a niggle.
Yep, done.
Brilliant. So generally if we find one, they like to travel with friends. I always say they never travel alone. So let's go find their companions. And you might find that one faded very quickly. Some of them are more stubborn. They might take up to a minute to fade. So make sure that you hold there and keep that dialogue opened. Some of the more superficial ones or the satellite trigger points around, maybe a main trigger point, fade much quicker. So let me know if I hit another tender spot.
Yep.
Okay, we're just going to hold it again and just breathe. And exhale, letting it go. So make sure that your clients are not breath holding, okay? These spots can be very tender and it can be quite uncomfortable, and breathing will just help stimulate that parasympathetic activity and help the client to deal with that pain and also help them release. And just let me know when it's gone. How's that pain?
Gone, thanks.
It's gone. Okay, good. So just let me know when that pain fades. And so I can feel that line of tension is coming down into the more thoracic area now. So for me, it makes better sense and it's easier on my body to change direction. Also, now that we're coming more into the thoracic spine, it's easier now for me to use an elbow as I can now tease that tissue away from the spine. So again, let me know if I hit a tender spot.
Yep.
Okay, we're just going to hold and breathe. Again, let me know if the pain gets any worse, but hopefully it will start to fade. And how's that now?
Better.
Okay, good. And we'll just keep holding until it's gone. Just let me know. And now?
Gone.
Good. And you'll get more confident, feeling when the tissue lets go, and sometimes prompt your client, but always get your client to confirm, as sometimes you might feel a release, but if the client's still sensitive and still feeling some tenderness there, it's worth holding until they don't feel that as well. So don't presume to know that the trigger pointing is finished. Again, changing directions, coming more into the thoracic area, for example. Again, we can use elbow, really nice through here. Assisted thumbs if it's really specific into those erector spinae, even assisted fingers into some of the smaller areas around the spine. Now, if we come back to the other area I found tension in this client, it was towards the insertion, so more of the middle of the muscle belly coming into the insertion of the shoulder at the upper traps. So, what's difficult here is there's no resistance at the front, okay? So there's no bony prominence in front of the upper traps. So if I'm to just put an assisted thumb in there or an elbow, I'm not meeting any resistance. So that's when it's quite nice to use what we call the pincer grip, which is where we use a relaxed finger underneath or in front of the belly of the trapezius. And that adds some resistance so as the thumb, the applicator on top, can then palpate the trigger points more easily. So simply coming in as a pincer grip, that finger in front, thumb on top. Okay, so now having that resistance means that I can push off the back leg without forcing the client's trapezius muscle towards the bed, because it's not going to reach the bed, so it will be uncomfortable. And again, just palpating slowly. Let me know if I hit a tender spot.
Yeah.
Okay, and we're just going to hold and breathe. The pain starting to fade, getting worse, staying the same.
Fade.
Okay, good. And let me know when it's faded completely. And how's it now?
Very much fun.
Good. Okay, and just moving literally millimeters. So they don't travel alone. Generally, if you find one, there'll be many close together. And in here, let me know if I hit another one.
Yeah.
And hold. And just keep breathing. And now.
No.
Okay, and you'll get into a rhythm with your client. Once you've explained it to them, it gets pretty quick, where they'll probably say to you, yeah, got one, yeah, gone. And it will become much a quicker process because it feels good to the client. And once they understand and they've done 2 or 3 with you, they get it. They want these trigger points released. So that communication will open up and it'll become a fast and smooth process. So don't worry about it, waking them up, taking them away from that relaxed state. Keeping them present itself will have effects on their nervous system, keeping them present, keeping them in their body and releasing some of that tenderness. So again, we could work right through that belly. I'm sure there's many more in there. Another nice area, since we're here to talk about, is the rotator cuff, often ignored, and really interesting trigger points around the rotator cuff that sometimes can come down the arm, some interesting places, so between the bicep and tricep, so it feels like connective tissue strain. Sometimes that can be a pattern from trigger points. So as we talked about in the theory, trigger points can refer. So often when you're working through a trigger point, you might hear your client say, oh, that's that pain, that's the pain I get right up into my head, right across the front. So a lot of the trigger points in the front of the neck, the upper traps, resonate into those tension type headaches, and so they might feel those same referral patterns as you work through the trigger points, and they will fade as you trigger point them. So again, working into the rotator cuff, I'll demonstrate infraspinatus here. Don't be surprised if your clients feel that up into the neck, into the shoulder, down into the arm. Even working through the upper traps, feeling some referred pain down the spine, for example. So again, very common for trigger points to have that referral pattern as well. So working into infraspinatus, again, often ignored, often very full of trigger points because they get used an awful lot, those rotator cuffs, especially if some of our clients are in quite a rounded shoulder position. What we don't want to do is, this is a very superficial muscle really, we really want to be careful not to be crushing that muscle belly into the bone itself. So focus on that 45-degree angle, teasing the tissue away, and you'll still be able to palpate each of those trigger points. So I find using an elbow in that area really, really subtle. So making sure that you lower your lunge so you're in a strong position and not crushing tissue into the bone, because you'll feel that bone as soon as you really sink into the tissue. You want to tease it away. And again, working with our client, let me know if I hit a tender spot. Keep the wrist and hand relaxed. Yeah. And then when we hit a spot, we're just going to hold. Again, you want to be in nice strong postures. As you saw, some of those trigger points took up to a minute to release. You want to make sure that you're relaxed, comfortable, and in a strong position. And as that pain fades, just coming out nice and subtly and working your way through that muscle. Okay? So you're not going to be trigger pointing every part of the body. You'll find you'll be working in those areas where you find there's bands you can't release with your other techniques. In terms of applicators, as I said, we've got elbow, assisted thumb, assisted fingers. We can even use a soft knuckle, for example, so into the glutes. That can be quite nice. If you're not confident yet with using the elbow, maybe try that. It's like your assisted fist or soft fist. You can even use the other hand to support if you struggle to keep your wrist at a nice neutral angle, and then slowly just palpating through the glutes with that soft knuckle or soft fist. Okay, lovely way to work through the glutes, coming under the glutes, pushing it out of the way with that elbow, and then using a nice soft elbow to palpate trigger points through the lateral hip rotators, piriformis, etc. So coming in and through. Again, working with your client, breathing until that pain fades. So a really simple technique, but just remember, warm up the tissue first, palpate well, and always communicate with your client. Don't presume to know where the trigger point is or when it's released.